Hi everyone, this is Dr. Reyhan, a pharmacist, and welcome to my channel. Today we're talking about retinol, one of the most powerful and most misunderstood ingredients in dermatology. Retinol is a vitamin A derivative. It belongs to a larger family called retinoids. We generally divide retinoids into two groups. One, cosmetic retinoids like retinol and retinal, which are available over the counter. Two, drug retinoids like terpenoin, adapalene, and tazartan, which are more potent and directly active and often prescription-based. Inside your skin, retinol is converted step by step into retinoic acid, which is the active form that actually binds to receptors and produces biological effects. That's why scientifically we know retinol does work, even though it's gentler and slower than terpenoin. Retinol works by activating retinoic acid receptors in the skin. This triggers several important processes. It increases epidermal cell turnover, which helps with dull skin and sun damage. It prevents clogged pores and normalizes sebum production, improving acne. It stimulates fibroblasts, increasing collagen production and improving fine lines. It reduces hyperpigmentation by regulating melanocyte activity. The peeling you see with retinoids is not classic exfoliation. It's a delayed biological response called retinization or retinoid dermatitis, where old skin sheds faster as new cells are produced underneath. How long does it take retinol to work? Retinol starts working at the cellular level almost immediately, but visible results take several weeks. In the beginning, your skin may even look worse. This is part of the normal adjustment phase. What can retinol help with? Retinol can be beneficial for acne and post-acne marks, uneven skin tone and dark spots, melasma usually as part of combination therapy, fine lines and wrinkles, dull and tired-looking skin. However, deep acne scars, raised scars, or advanced melasma need other treatments. Topical retinol alone is not enough. How to use retinol correctly? Here's where most people go wrong. Retinol is not a spot treatment. It should be applied to the entire area, for example, your face or neck. Use it only at night, not only because of photodegradation, but mainly because of photosensitivity. Start with a low concentration, usually 0.1% to 0.3% for beginners. Apply a pea-sized amount for the whole face. Use it every 2 or 3 nights at first, then slowly increase as tolerated. After applying retinol, always follow with a moisturizer to support the skin barrier and reduce irritation. And don't forget daily sunscreen. Retinol increases sun sensitivity and skipping SPF can cancel out its benefits. If you have sensitive skin, apply retinol on dry skin and use the moisturizer sandwich method. Moisturizer, retinol, moisturizer. Avoid applying retinol around the mouth corners and smile lines, on eyelids or near the eyes unless it's a product specifically formulated for the eye area. What not to use with retinol? Some ingredients can cause serious skin irritation when used together with retinol, so it's important to be mindful of how you combine them. Vitamin C is one of them. It's best used in the morning, while retinol is reserved for nighttime. Exfoliating acids like AHAs and BHAs, such as glycolic acid and salicylic acid, shouldn't be used at the same time as retinol. Instead, they're best used on different nights. Benzoyl peroxide, a common acne treatment, can also deactivate retinol, so these two shouldn't be used together. Pregnancy and breastfeeding. Topical retinoids are not recommended during pregnancy, even though absorption is low. If you're breastfeeding, risk is considered low, but avoid applying it on the chest and always consult your healthcare provider. Retinol is one of the most powerful molecules in dermatology, but consistency matters more than strength, and the right formulation matters more than the price. If this video helped you, subscribe to the channel, leave a comment if you have questions, and share this video to someone who is struggling with retinol. See you next time!